everyone, I'm Dr. Oberst at Park Hills Family Dentistry, and today we're going to be talking about tongue ties. Most commonly, moms come to me saying, my baby doesn't like to latch, or when he latches, he seems to be crying or upset, or milk's coming out of the corner of his mouth when he's drinking. And normally these are babies that are losing weight or having a really hard time drinking or eating. There's two types of ties. There's a lip tie, which is up top on their lip, and on the tongue ties on the bottom underneath their tongue. Most commonly, if you stick your finger in there, you can see in your own baby what it looks like. If you have trouble lifting their upper lip up, or if when your baby cries, he can't lift his tongue up from the floor of his mouth, that's a good sign that there might be a tie. The procedure itself is relatively simple. It really truly takes about 30 seconds to a minute, and we utilize a laser in our practice. The old practice was to use scissors to snip it, but the benefit of the laser is the healing period is much shorter and the child feels virtually no pain. So the great thing about infants and small babies is they require no numbing. Really and truly all we do is give them a little bit of sugar water on the tip of our finger before we do it, and then knock out the procedure in about 30 seconds. They feel no pain and they go home and they're ready to eat right away. Patients of all ages for tongue ties, I will say it's much easier on the patient the younger they are. Once they get to be 3 or 4, they start to have nerve tissue in that area and it requires more sedation. So if we can do this on an infant or a younger child, it's the best. We've seen somebody as young as 9 days old. Yeah, when you go home with your child, you'll see like a small yellow diamond where the procedure was done. They typically have no pain, no bleeding, or are ready to eat right away. I've even had a kiddo eat in the chair as soon as it was done. So your kid should be ready to roll and be back home and have no post-op problems.